start. Okay, that's great. Thank you, Dr. Shisha.
Right, doctor.
Yes, sir.
So we'll start.
Yeah.
Hello, I'm Dr. Seisha, medical doctor on the ward. Is this Mr. Robert, 56 years old?
Yes, doctor.
Mr. Robert, I'm here to ask a few questions regarding your health, examine you, and answer your concerns. Is that okay with you?
Okay, doctor.
Okay. Mr. Robert, before I proceed, can you tell me more about your health condition?
Yes, doctor. Actually, I'm having this yellowness in my eyes for last 1 month, and I was thinking it's because of some food-related issues or something like that, but it's not the case. It's getting more and more every day. I went to GP and he has prescribed some multivitamins, but
Okay.
doesn't help me a lot. I'm today here to ask to discuss with you what's going on with me. Why I'm having this issue.
Okay, I truly appreciate your concerns, Mr. Robert. Can I ask you a few questions about this further?
Yes, sure, doctor.
Yes. So this yellowness in your eyes, did it start suddenly 1 month ago, or did it start gradually and increasing?
Yes, doctor. It's a gradually.
Yes. Okay. And so you said this started 1 month ago, and it has been increasing slowly. And did you find any associated symptoms? Like, did you have any tummy pain during this 1 month
Uh, Initially, no, there was no pain, and now I feel sometime, in the upper tummy area, I have some kind of pain.
Okay, you have a pain in upper tummy, and
Yeah.
this pain is continuous, or it also has been increasing?
It's increasing day by day now.
Did you notice any change in your bowel habits?
No, doctor.
Any change in color of your stools?
Yes, I have observed that my stool color is getting, pale day by day.
Okay, and did you notice any change in your waterworks?
Yes, it getting more darker as compared to in the past.
Okay, any problem of cough or breathlessness?
No,
Okay, did you notice any pounding or racing or pacing in your heart?
no,
Okay, and did you notice? Did you have any chest pain?
no.
Okay, and so did you travel anywhere recently in the past few months?
No, doctor. I'm in my town since many years now.
Okay, and are you having any medical condition that I should be aware of?
No, doctor, I was quite healthy and I'm exercising daily, taking healthy food.
Okay, and uh, you're taking healthy food. Anything in particular, like as a sort of diet?
No,
Okay,
same
and
as usual.
same as usual. Okay, and you're so, Mr. Robert, did you have any fever in the past 1 month or before that?
No, doctor, I didn't check actually.
You didn't check. And okay, sorry, did you have any high temperature you felt?
No,
No. Did you have any joint pains?
no,
And did you have any rash in any part of the body?
no,
Okay. Any night sweats?
no.
Okay. Other than the point that your tummy was hurting, did you notice any lumps or bumps over your body?
No, doctor, I didn't notice.
Did you notice any weight changes recently?
Oh, yes, doctor, you're sure. I have lost a couple of kilos, in around 5 to 6 kilo over the period of 2 months now.
Over 2 months. Okay. And
Yeah.
okay. And okay. So did you know, do you have any weather preferences?
No.
No. And other than the point that you have this yellowness of your eyes, did your family notice you look pale than before?
No, doctor.
Okay. Any vision problems?
Sorry.
Any vision problems? Any problem in
No
your
vision
vision?
problem. No vision problem.
Okay. Any weakness in your body, any part of the body?
No, doctor.
Okay. And any, so you're not on any medications, right? Just to confirm.
No, no.
Except for the vitamins which your GP has prescribed, right?
You're absolutely right, doctor.
Okay. And any family history of significance that I should be knowing? Any familial condition?
No, no, doctor.
No. Okay. So, Mr. Robert, I would be asking a few private questions if that's okay with you.
Okay, doctor.
Okay. Do you smoke?
Yes, doctor, I do smoke.
Okay. How many cigarettes a day?
2 packs per day.
And for how many years?
It's almost 15 years now.
Oh, that's a long time, Mr. Robert. Mr. Robert, I just need to tell you that cigarette smoking in any quantity is not good for your health. I would recommend you to cut it down, please. Mr. Robert, do you consume any alcohol?
Uh, Doctor, yes, I used to drink a lot of alcohol in the past, but I have nowadays I'm not taking for many years.
Oh, okay. When did you stop drinking alcohol? How long back?
It's 5-6 years now.
Okay. Any particular reason why you stopped it?
Because it was disturbing my life, my social life, my personal life. So I have decided not to take
Oh,
no alcohol.
that's a very good decision on your part, Mr. Robert. So before this 5 years, you have been drinking a lot of alcohol for how many years?
It was not too much actually. It's almost 10 to 15 years. It was. I was usually taking the alcohol on parties and occasions, not a
Okay,
drinker at all.
okay, that's good. That's good. So, Mr. Robert, so do you drive?
I do drive, doctor.
Okay, and okay, that's good. What do you do for a living?
I am a school teacher.
You're a school teacher. Has this affected your job? Do you feel weak or tired recently?
Yes, doctor. Yes, for last couple of weeks, I'm not going to attend my classes because of this problem. I'm starting, feeling bad, feeling sick, sometimes throwing up. That's why it's not, socially unacceptable. So I didn't go there.
Right. You said you were throwing up, Mr. Robert. Can you tell me more about it? Are you throwing up every
Yes,
day?
doctor. No, not every day. It was started almost weeks before, and it's on second, third day. I need to throw up. I feel
Right.
sick all the time nowadays.
Right. And you have lost your appetite also?
Yes, doctor.
Okay. And okay. So, right. So, okay, Mr. Robert, there's one more personal question I would like to ask you. Is that okay?
Yes, doctor. Please,
Yes.
you can ask.
So, are you sexually active?
Yes, doctor.
Okay. Do you have a permanent partner?
Yes, doctor. I have a regular partner.
Okay. And I don't mind me asking, but I have to ask, do you involve in unsafe sex?
No, doctor.
Okay. And another personal question, Mr. Robert, do you indulge in recreational drugs?
No, doctor. No, not at all.
Okay. Okay, Mr. Robert. So, okay, I would like to examine you, please.
Okay, you can examine me. What do you want to see, doctor?
I would like to start examination, general examination from the foot of the bed and the general body
Okay.
of the patient, if he's cachexia or his general built and
Patient looked hectic and emaciated.
emaciated. Okay,
Yeah.
and I would start my examination from the right side of the bed with the hands. I would look at the nails first, at both the hands,
What,
the nails
what do
for
you want to see? What do you want to see in the nails?
any leukonakia, any
No,
clubbing,
liquid. No clubbing.
any koilonakia,
No.
I would ask him to flip his hands, and I'll look at the palm for any palmar arrhythmia.
Is there anything specific you want to see in this patient, especially on the nails? Do you have anything else in this patient after taking this history? Okay, move on.
Specific on the nails.
Okay, move on, doctor, please. Time is running.
Right. So I will look for any Dupuytren's contracture and
No contractures.
So I will look for.
No contractures.
I will look at the arm. I will look at the pulse of the patient, and then
Pulse is normal and regular. Good volume.
I would like to look at. I would check the vitals and temperature chart.
Temperature patient is AFib, his blood pressure is normal.
Blood pressure is normal. Okay. I would like to look for any scars on the body and on the abdomen or on the upper limbs. Any scars of any previous surgeries or any interventions?
No intervention, no surgeries, no tattooing.
No tattooing. Okay.
Yeah.
And then I would look for any spider nevi on the upper extremities and the back and upper chest.
No spiders.
Then I will go for a face examination. Look at the conjunctiva, which is jaundiced, and look for lower conjunctiva for any pallor.
No pallor.
And I would like to look into the mouth of the patient for any oral ulcers or any cyanosis on the lower edge of the tongue.
Oral cavity is normal, doctor.
Oral cavity is normal. Then I will go for the neck examination. I will look for any scars in the neck, or then go for palpation for looking for any lumps or bumps in the neck, especially in the left supraclavicular area.
No lumps and bumps, and thyroid is not enlarged.
Thyroid is not enlarged. Okay. Then I will go for chest examination, looking for any gynecomastia.
No gynecomastia.
Okay. Then I will go for I will examine the abdomen, starting from any hepatomegaly.
What do you? Yes, you can see there is a mass in the epigastric area.
There is a mass in the epigastric area.
There is a mass and there is hepatomegaly.
Hepatomegaly, and there is a mass.
There is a mass and there is a hepatomegaly
in the epigastric area. Okay. So okay, is it tender to touch?
No.
Okay, I will do the Murphy's sign.
Okay. Negative.
Negative. Okay, and then I would like to check for splenomegaly. Any other organomegaly? I will check in.
Spleen is normal. Spleen normal.
I will check for
2 minutes left, doctor.
Any distension of the abdomen?
No distension.
I will check for fluid thrill.
No fluid thrill.
Okay, I will check for pedal edema.
Pedal edema, no pedal edema.
No pedal edema. Okay. So, yes, Mr. Robert, can you tell me your concerns?
Yes, doctor, I have a lot of concerns. What's going on with me?
Mr. Robert, there are many things on my mind that could be the cause of your pale yellowness of your eyes. The most important being viral hepatitis. It could be infectious hepatitis, or it could be autoimmune hepatitis, or it could be something severe that is I'm not able to understand, doctor. So it could be something severe.
What do you want to say? What do you mean, doctor? Serious? What is that? I'm going to die, doctor. This is something more serious.
Something like it could be something serious like pancreas, something related to pancreatic carcinoma,
Okay.
cancer of the pancreas. So these are the few things on my mind. However, to
Mhm.
confirm, I would need to do further investigations for you. So anything
Okay.
else that concerns you?
Yes, doctor. I'm interested to know that are you going to admit me today?
Yes, definitely, Mr. Robert. I would like to admit you to first follow up with your blood investigations and then
Mhm.
arrange a scan for you for your tummy, which will let
Time
me
up. You can complete, doctor.
scan for your tummy to find out, ultrasound scan for your tummy to find out about this mass in your tummy and
Mhm.
about details about your condition, which will let me to diagnose you and treat you better. Any other concerns, Mr. Robert?
Yes, one more concern, doctor. Will this, yellowness of my eyes will go away by itself?
Uh, Mr. Robert, I would be able to tell you that better only after finding out, coming to a conclusion about the diagnosis. But in most of the conditions, if the liver is not permanently damaged, then this can go back to normal.
Okay. Okay. Thank you.
Okay. Okay. Thank you, Mr.
Okay, doctor. Thank you, doctor. Thank you so much. So, Dr. Sisha, you have 5 minutes to with the examiner now. Do you want to present your case, or do you want to summarize up your case for a few seconds? Then you want to come back to present me.
Um, summarize my case. Okay. Okay,
Okay,
doctor.
your time starts now.
So this is for summarizing, doctor.
Yeah,
Like
yeah, yeah.
I will be preparing in myself.
Actually, Dr. Sisha, in
Or
exam,
should I
real
be?
exam,
Yeah.
yes, you
Okay.
don't have even time of reflection. It's a lot
No,
of
no,
things
no.
which are
That's why
coming in mind.
I'm not sure, doctor, what is this. So I will start. Okay.
Okay,
This middle-aged gentleman, Mr. Robert, has come here with jaundice and uh, he has been throwing up and he has tummy pain. So, this is a case of acute liver, acute hepatitis.
mhm,
Acute hepatitis, and there is no signs of, as there is no signs of chronic liver failure, and there are no signs of uh, any decompensation. And the probable cause of this condition could be a viral etiology. However, probable cause could be a viral etiology, or it could be because of carcinoma of the pancreas. Uh,
okay,
and is second in my differential, and third could be a mass in the gallbladder, carcinoma of the gallbladder. So,
okay. Is there anything else?
okay,
What
and
are the differential diagnosis, doctor, of any patient having mass in epigastric area?
now mass in the epigastrium can be either cancer of the stomach or
Okay,
lymph nodes in the stomach,
okay,
or
okay,
if it is a pulsatile mass, it could be aortic aneurysm, and
okay,
it could be a pancreatic carcinoma, head of the pancreas carcinoma.
o-
It could be a
okay,
gallbladder, and it could be either an obstructed
mhm,
gallbladder or it could be an enlarged gallbladder. And it could be enlargement
mhm,
of the left lobe of the liver because of, if it is isolated enlargement of the
liver.
left lobe because of any space occupying lesion in the liver, could be something related
o-
to pyogenic uh, abscess or
Okay, so
any abscess.
okay, you're very nice. So tell me what's going on in your patient, especially.
This patient has weight loss and tender liver enlargement, which is acute in onset. and he's jaundiced, and he doesn't have any. He has another mass in the abdomen, epigastrium, which could be related to either carcinoma of the stomach with liver metastasis. It could be also carcinoma of the
Tell me
pancreas.
tell me one year top differential, then we will move forward because you are running out of time, you know.
Um,
Tell me one year differential
top
diagnosis at the top. Yes.
the
Based on your history and examination, you have a lot of clues over here. So what's your top differential?
top differential is Doctor. I think it is hepatitis, doctor.
Okay. Okay.
But
So
I am not sure.
how you're going to investigate?
Investigations, yes. I would like to do a full blood examinations, including a full blood count, liver function test containing total bilirubin as well as direct and indirect bilirubin. Also, I would like to do the renal function test and further on the PPINR and the synthetic functions of the liver. And also, I would like to go for some investigations like ultrasound of the abdomen to localize and find out about the mass, and also the total viral screen, blood viral screen, and uh, also then a
What else?
CT scan of the abdomen and
ঠিক আছে দেখছি আপনার কাছে যদি শেয়ার করে আপনি
Time
আমাকে
up.
হোয়াটসঅ্যাপ করে দিন ঠিক আছে
Time up, but you can complete, please.
yes, a CT scan of the abdomen, autoantibody screening, and endoscopy, upper GI endoscopy also.
Okay.
And that's it, doctor.
Okay, for example, this is a case of, for example, HCC. What investigation you will do? Any biomarker
alpha
in the blood you
fetoprotein.
can order for
Blood alpha fetoprotein.
Okay. Okay, if I say this is a pancreatic carcinoma, what you will advise for this patient?
Pancreatic carcinoma, I will advise CT scan of the abdomen, and in blood tests I
Any
would tumor. Yes. CA 15-3.
If it's a colon cancer, then what you will advise him?
If it is a colon cancer, I will advise him CEA, carcinoembryonic antigen, and colonoscopy.
Okay.
And biopsy.
How you're going to manage this case? You are already, you know, consume more. You took already 1 minute 20 seconds. Okay, how you're going to manage? Let's complete this first, then we will discuss. Okay.
Okay. I will admit this case, and then we will arrange for these tests in investigations. Initially, is jaundice, so we will check all the blood test reports, and I will involve a multidisciplinary team, including the gastric doctor, the stomach doctor, and the medicine doctor, and also specialty nurses for his management of his condition. Also, we will give him IV nutrition for some days till his tendency for throwing up is decreased. Give him some antiemetic also.
Okay.
And manage him symptomatically till we diagnose the condition, and then go for specific treatment for him, including a multidisciplinary treatment.
Okay. For example, this patient is having carcinoma in pancreas, head of pancreas. So how you're going to manage this case? What you would advise?
So if he's having
What treatment options are available?
for treatment of carcinoma head of the pancreas, if we diagnose it's an isolated disease and not spread and does not have any distal metastasis, then we will go for a Whipple's resection and then anastomosis of the gut.
Okay, doctor. Thank you so much. Okay, doctor. Thank you so much. Thank you so much.
Thank you, Dr.
So, Dr. Sisha, so you took a lot of time. It's totally unacceptable in exam, actually. Let's talk about your performance first. What do you think? What's going on with this guy? He's having what kind of jaundice he's having? It's a pre-hepatic, hepatic, or post-hepatic? What do you think?
It could be pre-hepatic. No, sir. It could be hepatic or post-hepatic. Mostly because post-hepatic, because he's saying he had this paleness of the stools.
Okay. Let's talk about your performance first. So, physical examination, skill A. Okay. So there are a lot of things need to do in this case. If you're suspecting someone is having obstructive jaundice, the need to look for the shiny nails. That's very important, a peripheral sign, which should not be missed in any case. And once you see shiny nails in exams, then you look for the excoriation marks. So these are vice versa. Okay. So obstructive, we will discuss how to identify, how to recognize obstructive jaundice in a history. So in the physical examination, you did very well, actually. The examination was time consuming, but you have fulfilled all the criteria of this examination. Identifying physical signs, you could mix in this, two physical signs, very important physical signs. So you are going to be on the borderline. Clinical communication skills, Dr. Sesha, there are a lot of histories, need to talk about. Once you have find a person with the jaundice, how to take a history, it's very important. I told you, I told you in the first minute that I have a problem with the jaundice, yellowness of eyes. Okay. Then you come up with the Odipara. Okay. Then Odipara. Then you ask about your waterworks color and the stool works, stool colors. Okay. I have give you a clue that my stools are clay, colorless, and the dark urine. So once you get an idea, just give a few more questions over here to establish either you are dealing with the obstructive jaundice or not. What is this? That's itching. Very important, point over here. So need to ask about the itching, and then rather than to ask about the racing in the heart, chest pain, cough, travel history, diet history, joint pain, rash, night sweats, lumps and bumps. Okay, acceptable. And I give you a history of weight loss. You ask me how many kilos in over how months, what is the duration? I told you that 6 kilogram over a period of 2 months. Need to ask, was it intentional or unintentional? That's a very important question over here. Okay. And then weather preferences, pallor, visual problem. No, then you ask about the neurological questions, then drug history, family history, and or you come up with the private questions. Okay, then smoking. We will discuss history. A lot of things were missing in the jaundice history, actually, which should not be missed. So clinical communication skills will be on the borderline. Differential diagnosis, you're good after probing by the examiner. And if someone is old age, 55 years old, and he's having weight loss and dark jaundice, deep dark jaundice, and he's having obstructive feature, until proven otherwise, it's a pancreas, it's a cancer. First thing is that. Okay. It's a cancer until proven otherwise. In this age group, patient emaciated, weight loss, epigastric mass, and obstructive jaundice. So until proven otherwise, we are dealing with some kind of malignancy, and most likely in the pathway of gallbladder and common bile duct or the head of pancreas. The most common is head of pancreas carcinoma. Your differential diagnosis are good, but you were shaky. And when the examiner was asking again and again, can you finalize your top differential? Then you come up with the acute viral hepatitis. This will give you a very bad score over the differential diagnosis, final diagnosis. If you are not going with this Yes, my voice
Hello,
is clear,
Dr.
doctor.
Fabio.
Can you hear me, doctors, now?
Yes, it's working.
I'm actually facing some internet, issues today. So clinical judgment again is the clinical judgment. What is the clinical judgment? Actually, clinical judgment is how you are going to test and how you're going to treat the patient. Then coming to the managing patient concerns. Managing patient concern, Dr. Sisha, you need to be very open and very clear in a few lines. Always remember, dear doctors, a lot of doctors over here, the first concern you need to memorize, like your name. These are the fixed lines and they will remain the fixed according to the symptoms based on your history. I highly appreciate your concern, Mr. Robert. Based on your history and examination, I have a few things in my mind that might be a problem in your liver, might be a problem in your gland, which is known as a pancreas, that might be a problem in your, this pathway known as a gallbladder, that might be a problem in your gut. So it's very early to see what we are going to do now. Now you're going to give us some differential diagnosis in front of the surrogate. Then what we are going to do now? Then you start your plan of management within a 30-second. What we are going to do now, we are going to run some blood tests and scans of your body. Okay. Don't wait if he will give you another concern over here. Just answer the concern over here. Maybe you will finish the lot of concern in the similar lines. What we are going to do now, we are going to run some blood tests and scans of your body. Once the result will be available, we will sit together and make a management plan with you. And most likely you will be treated a gut doctor and liver doctor. Okay, so in this way you can answer first concern in any disease based on your history and examination. If you are very sure, put your differential diagnosis at the top. For example, for some time myasthenia gravis is there, you can put myasthenia gravis straightforwardly. If hypothyroidism, you can put the hypothyroidism at the top. Then you can add your differential diagnosis, but we need to exclude other causes also. So in this way, then the second concern was, so is it a cancer? Based on your history and examination, there is a possibility. When there is a no possibility, you can say it's unlikely. When there is a possibility, strong possibility, then you are coming up with this answer based on your history and examination. As you have a mass in your tummy, most likely seems like there is a, but it's very early to say. You are giving a warning shot, and immediately you are covering up your warning shot, but it need to be investigated further. Okay. So will this yellowness will go away by itself? That was a concern in the exam at Lahore Center in the recently second diet. So it's very early to say the things it's very early to say about go away or not, but it's less likely if it's causing some compression in the pathway. So it's very less likely. Okay, I will be in better position to address your concern once the result will be available. Okay, are you going to admit me? Yes, I'm going to admit you. Straightforward, you have answered very well. Coming to the patient concern was good. Patient welfare. Dr. Sesha, remember, this is the clinical consultation. We are dealing with the skills and we need to fight for the skills at each and every point. You ask about the smoking. Okay, 2 packs per day for 15 years. So how to ask the surrogate to stop smoking? 3 lines. Mr. Robert, smoking is injurious to health. I would advise you, okay, I would advise you to stop smoking. If you need any help, I can refer you to the smoking cessation clinic. This is a universal word in the PACES. Okay, so you are going to ask him, I would advise you to cut down. Cut down is alcohol, not smoking, Dr. Sesha. Okay, be careful using these words in exam. That will affect badly on the score. You know each and everything, I understand, but because of a little bit you are in hurry, so be careful what we are going to uh, say to the surrogate. They are listening very carefully in exam actually. So about the alcohol, come to the alcohol. Alcohol is not alcohol. Is not drinking alcohol. You did very well. So I really very happy that you have cut down your alcohol. You are not drinking more, and no need to ask him why you have cut down this and that, because it's not our target. Our target is different to fulfill the criteria. You ask about the driving, and you left this concern, uh, halfway, and you jump to the other things. Then coming to yes, you didn't even answer about the driving. Okay, how could we answer if the patient is having such kind of condition and driving? Okay, I would advise you, if you don't know about the driving, for example, you are very confused at the moment, how I should, react on this driving, may or may not. So you can cover up by this way. Mr. Robert, I'd advise you to stop driving time being, and we will give you suggestions, okay, about the driving after your labs will be available. The first response like this. The second is, you can stop this driving. This patient is having mass, he is emaciated, so it's a straightforward case of malignancy. And the second way is very simple. I appreciate your concern, Mr. Robert. Driving, I would advise you to stop driving and inform DVLA, 2 lines. Okay, then you coming up the job, school teacher. So he was a school teacher and you didn't ask any help, and with the home he's living, you didn't ask any help. So this, your skill, patient welfare is going to be affected very badly. Progressive jaundice, weight loss, and not identifiable causes and suspicion of cancer. Then that can, you can ask the patient to stop driving for a while and inform DVLA. Either I give you a first response, just inform him. Let Yes, Dr. Nazia, let me finish and we will discuss on that. Okay. So patient's welfare is going to be affected very badly over here because you didn't offer any help in this case. So he needs a lot of help on job, on social life. So he needs a lot of help. So welfare is, if going to be affected, your score overall might be 150 and more. If your welfare is not good in exam, very narrow margin of welfare, 32 marks, you need to score at least 28, then you will pass this skill. So if the one skill is not pass, your score is more than 160, they are not going to pass any candidate if their skills are, not passed. So we need to work on our skills rather than the overall history, how to overall long clinical consultation or overall paces. Please remember, dear doctors, just target your skills, make your schemes that your schemes must contain each and every skill. At least you need to touch every skill superficially, but you need to touch. Otherwise, I don't know what will be the results will be there if the skills are not going to be fulfilled. So this was the performance of Dr. Sesha. Now I'm going to share with you uh, how to approach a case of jaundice if you are facing a patient with the jaundice. So look at Dr. Sesha. If the patient is having jaundice, you are going to do the OD-para. After OD-para, just decide either you are standing with the pre-hepatic, hepatic, or post-hepatic. There are three differential diagnosis if you use an umbrella term. Okay, pre-hepatic, most likely hemolytic anemias, Budd-Chiari syndrome, okay, or some other congenital disorders for bilirubin. Otherwise, second is hepatic. Hepatic are mostly acute viral hepatitis and chronic viral hepatitis, then the metabolic disorders like hemochromatosis, Wilson disease, alpha-1 antitrypsin deficiency, any drugs, any toxins are there. So hepatic are the risk factors. Then the post-hepatic, the post is, then in the post-hepatic, the pale stool. So once the pale stool is there, how we will differentiate? We are dealing with the pre-hepatic, hepatic, or post-hepatic. At the beginning of the case, you just gave a 3-4 question at the beginning before going to Odipara. Okay, for how long it has been started, for how long? So it's a 1 month duration. So it was gradual or sudden. So it's gradual. It's a progressive. Yes, doctor, it's a progressive. What making it more? I don't know, doctor. What making it better? I don't know. Then association. Before going to the association, just do ask, what is the color of your waterworks? What is the stool color? If the watercolor is dark and stool color is pale, the third question must be, do you have any itching? At what time of the day you have itching? You are having itching more, day and night or night. So nighttime itching is there. Do you have any scratch marks? You are scratching your body again and again. Yes. So once you have established that you are dealing with the post hepatic, so your start question will be started from the post hepatic now. In the ODPARA, the last A is local associated questions. Dear doctors, you are dealing with the jaundice. It's related to the GIT system, GIT hepatobiliary. So your associated question must be first local associated question from starting from the mouth. Do you have any soreness in mouth, difficulty in swallowing, pain in your chest while eating, any tummy pain, any loose stools or hard stools, any blood did you notice in the in your stools, or any you're throwing up your blood, any tummy swelling? So GIT related any question you must ask first, then come to the differential diagnosis. Differential diagnosis, post hepatic differential diagnosis is very straightforward. So autoimmune condition might be stones, there might be cancer, there might be infection or external compression. So most common causes of obstructive jaundice in the old age until proven otherwise. We have discussed that it's a cancer. Otherwise, it's a young female, 45, 50 years old. The similar condition patient is coming with you with the jaundice, and really very sorry, doctors. Really, it's internet issues. Okay, so then coming to the hepatic causes of jaundice, you need to establish also, and the pre-hepatic is very easy. Childhood, transfusions you can ask. Okay, any change in shape of your face means that if there's thalassemia, there is a bossing of the head, and if there's any blood clot history in the past or the recent past. Why? Because you need to rule out the Budd-Chiari syndrome. So once done with this, so coming to the immediately general questions, that's a buffer, weather preferences, weight changes, anorexia, fever, fatigue, itching, rash, racing in the heart. What about sleep, snore, and sweats? So if you miss some questions at the top related to your obstructive jaundice, if you have a specific set of questions of general symptoms, then it will cover up. Like in this case, itching, rash. So itching is there, rash is there. If you forget to ask about that, But don't worry, you have a set of questions that can cover up this. After finishing this question, jump immediately to the your next skill. I used to say next skill. Why? Because you have to grab a 4 extra marks of skills. Patient welfare. Ask about smoking, alcohol. Even before smoking alcohol, ask about how this condition is impacting on your daily life. With whom you are living. Do you have any support available? If the patient said yes, do you need more help? No, thank you. Are you financially supported? Yes or no? Okay. How this what do you do for a living? First question. How this condition is impacting on your job? Do you need any help? Then occupational health. Okay. Then refer to there. Then driving. 3 skills. Patient welfare has been done. No need to give a lot of questions there because you don't have a time there. So after finishing, they come to the social history, smoking, alcohol, drugs, party drugs. Dr. Sesha, please try to modify these words. You are using these words. These are good words, but I would prefer if you can say party drugs rather than what you have said there. Which drugs? Recreational drugs.
Recreation
This,
drugs.
yeah, recreational. Just mention a party drugs. Okay, and that was a good sounds good. Otherwise, then coming to the next we have after this traveling history, if there is relevant traveling history as a surgical history, then go for the examination. How to go for the examination is very important in this case. Look at the examination steps over here. The first thing, you look at the patient and look for any stigmata of DCLD is there or not. Okay, appearance, what is a cachectic appearance, and temporal wasting is there not, sunken eyes, dehydrated patient. Okay, then hands, if the patient is having obstructive jaundice, the hand specific thing is shiny nails. Dr. Sesha, next time if you are dealing with a case of obstructive jaundice, just look for a shiny nails. Of course you need to do the flapping tremors, essential tremors, wasting, of course, anemia, chylonychia, there, clubbing is there, but specifically we are overlooking these findings, and this finding having us 1 mark. Then coming to the next pulse, then the lymph nodes, of course, needed to know. Then eyes for jaundice, and coming to the mouth, any uh, soreness there. Then jump to the abdomen. You need to come very fast. Why? Because your targeted system which is involved is abdomen. Be fast, 30 to 40 seconds or maximum 1 minute. You should finish your peripheral signs and go to the abdomen, because liver and spleen are mass. If you just palpate and don't give the edges, consistency, smoothness, surface, tender, non-tender, if you will just decide these things, it need time, almost 2 to 3 minutes. So you don't have a time. You can save your time in the periphery and go to abdomen. Is mass is there, just see mass is mobile, not mobile. What is the surface? What is the the borders are there? Then pedal edema, unilateral leg swelling is very important if we are dealing with the Budd-Chiari syndrome. If we are suspecting in that case, especially, so we can just cover up this case in this way. Coming to the next part is when the surrogate is telling you, examiner is telling you 2 minutes left, leave everything wherever you are standing. It will reduce maximum 1 to 2 marks. Otherwise it will not affect your overall concern. Now the second next the scale is a concern is having 4 marks extra. So this is a separate thing. Now you are going to enter in a new skill. So once the examiner is giving you a warning shot of 2 minutes left, leave everything. Maybe you will miss 1 mark. Go to the next skill. That's a concern. If you are going to answer your concern in a good way, nobody can deduct you a single mark. Nobody, really, believe me. So concern, how to identify, how to answer a concern, that's a very simple way. If you don't know, if you know, in a both way, you can start with the based on your history and examination. I highly appreciate your concern, Mr. Robert. Based on your history and examination, I have a few things in my mind. Most likely you have a condition like this and that. Okay, what we are going to do now? Then give a plan of management. And the RCP criteria is management plan will be chosen by a patient. So you are going to mention over here once the result will be available. We will set together. We will, not me. It will not we will decide. No, we will. Me and you, patient. We will sit together and make a management plan according to your wishes. So we will sit together and make a management plan. Okay. So you are going to mention patient, autonomy here. So another skill, another, ethics and law, you are going to cover up this. So after concern, you will go to the examiner. Mostly examiner, they are not asking the history points, what's your present your case, because they are listening very carefully. If some examiner want to give you a tough time, maybe he will take some time. Otherwise, they are coming up with, tell me, doctor, what's your differential diagnosis? So be sensible. If there is a mass in epigastrium, give a differential diagnosis of mass at the top. Halas, no need to go hepatitis or not hepatitis. No hepatitis. If there is hepatitis on the background of DCLD, okay, I can understand. It's not, maybe it's acute or chronic, but the most likely in this case is a mass, differential diagnosis of mass. Mass, it might be a pancreatic carcinoma, it might be HCC, it might be cholangiocarcinoma, it might be a stomach cancer. It's very early to say. So how you're going to investigate? Investigations, we know everyone. Baseline investigation and a specific ultrasound abdomen to confirm my diagnosis in a short case, in a long clinical consultation. Whenever examiner is asking, what's your first line investigation? First thing is, I would like to do the ultrasound to confirm my diagnosis. In a short case, either long case. Is a first investigation apart from the baseline. Then come up with the other investigations. What do you want to see? CT, MRI, endoscopy, colonoscopy, and any tumor markers, CEA level, CA 191. By the way, Dr. Sesha, it's a 191, okay, for the pancreatic carcinoma, and other your tumor markers are good. So management plan, Dr. Sesha, remember these, how to investigate, how to manage. These are the fixed word. These are the fixed format. Don't modify in every second case. This must be a, fluency matters a lot, because time is money. Time is your passing there. If you will sit and think about there what I will do for the management plan, no, just answer in a simple way. Management, sir, pharmacological, non-pharmacological management is fixed for everyone. According to the case, you can modify 1 to 2 steps, otherwise same for all. The first thing is patient education and counseling. The second thing is lifestyle modification. The third thing is nutritional support. GI case nutrition support mandatory. Then socio-psychological support, okay. Then multidisciplinary team, liver doctor, gut doctor, and a gland doctor. But in front of the examiner, don't use these words, a layman language. You need to tell him liver hepatologist, gastroenterologist, and endocrinologist. Okay, they will mind if you will say in a layman terminology in front of the examiner. So you need to switch your frequencies and band of stations while you're talking to the surrogate or with the examiner. Be careful in this at that time. So non-pharmacological, always patient education, counseling, lifestyle modification, socio-psychological support, nutritional support. Okay. Then multidisciplinary team, including this doctor, according to the specialty, going to the specific. First line is symptomatic management. If the patient is in pain, I will relieve the pain. Okay. If the patient is throwing up, I will give antiemetics, proton pump inhibitors. Okay. If the patient is having any kind of constipation, I will relieve the constipation. Then I will involve the surgeon to look for the possibility to relieve the obstruction of, in this case, what are the possibilities will be available. If the pancreatic cancer, of course, surgery. Okay. If colonic cancer, if other cancer, then according to the specialty. So how you can, modify and you can utilize your time, given time for this case. Okay, doctors.
Assalamu alaikum, doctor.
Yes, walaikum salam, doctor.
Just can we repeat the differential diagnosis for epigastric mass again? Sorry.
Doctor, epigastric area, just a minute. I will show you something and you will never forget again in life, inshallah. I will try my best.
Thank you. Okay.
Look at here. Look at here. Stomach, liver, pancreas, duodenum, spleen, adrenal glands. Okay. Remove this spleen, adrenal gland, all other 4 structures if there is a mass. So these are the differential diagnosis: stomach cancer, liver cancer, pancreas, and duodenal gut cancer. Other thing you can add hepatobiliary cholangiocarcinoma, and yes, cholangiocarcinoma, or any compression. It's very difficult, doctor, to differentiate. Even if the examiner is asking you to differentiate, don't give anything. That will negatively impact on your scoring, most likely, because nobody knows until proven otherwise. It's a radiological diagnosis, so we can give a differential diagnosis. That's why they are keeping a skill of differential diagnosis. So in this way, you can put these differential. Why? In this case, pancreatic, because the most common obstructive cancer is a head of pancreas. Yeah. Okay, doctor. Did you get your answer? So if there is no question, then I'm going to end this meeting, and we will see you again in the next session.
Sir, what is the difference between daytime itching and nighttime itching?
Nighttime itching is specific because there is some mediators they are secreting at the night, so the patient is unable to sleep because of this. That's why we are giving no opioids in these cases.
So daytime itching, then what I would say, if patient complains itching in daytime, then
Daytime itching, most likely, infective causes, most likely we are dealing.
thank you,
Like,
sir.
Sir, why we stop driving?
stop driving because patient is throwing up, patient having epigastric mass, and it's very early. Not stop. Yes, I advise you to stop driving for now. Okay, and we will recommend you, because written in the books, if there is cancer, then he need to inform the DVL if patient is symptomatic. If the patient is asymptomatic, okay, no need to worry about that. The patient is symptomatic, he is sitting in front of you in the OPD, so you can ask the first thing, stop driving, and we will inform you. Okay, for the further we will give you advice.
Okay, thank you.
Okay.
So can you repeat what you said about Budd-Chiari syndrome? Is it a differential of obstructive jaundice?
No, it's not a differential diagnosis of obstructive jaundice. It's a differential diagnosis of prehepatic jaundice. When you are going to elaborate what kind of jaundice you are dealing with, then you need to give a questions of all three jaundice: prehepatic and hepatic and post-hepatic. You need to screen at least, because the examiner will catch you, because a lot of obstructive jaundice are related to the intrahepatic causes also. Intrahepatic cholestasis is one of the cause of obstruction also. So you need to screen those questions also. That's why we're keeping HCC also in this case, differential diagnosis. Okay, doctor?
Sorry, doctor, you said about how to differentiate between pre-hepatic and hepatic and post-hepatic by history. In history taking, how to, please, can you repeat that again?
I can repeat, but doctor, actually, okay. Post-hepatic, it's depending on the color of stools and color of urine and itching. These are obstruction until proven otherwise. Pre-hepatic just ask about any hemolysis or any blood transfusion in the past, especially in the childhood. The first thing. The second thing is any blood clot history. The third, any history of jaundice with the flu-like illness, Gilbert, and these kind of congenital hyperbilirubinemia are associated with some kind of viral illnesses. Whenever the patient is having viral illness, they are developing jaundice. Hepatic, you need to be very clear. If acute hepatitis, ask the question, Mr. Robert, did you feel any sickness or throwing up or any high body temperature before the onset of this yellowness? Because it's a prodrome, acute viral hepatitis. Chronic hepatitis, hepatitis B and C, just do you have any past history of injection, infusion, blood transfusion, tattooing, piercing, dental surgeries? So you will go to investigate similarly in like a HIV history. So hepatitis B, C, HIV history is almost almost same. Be careful if you're dealing with the jaundice. Search for a tattoo in any RCP exam. This might be the clue for your case. Don't miss it. You get your answer, doctor.
Yes, thank you so much.
You are welcome, doctor. So thank you so much, doctors. I'm going to end this meeting now. And if there is any question, please write down in the chat box. I will try my best to reply on that. Thank you so much. And we will see you very soon, inshallah, with the new case. This case came in Lahore recently, almost 10 to 15 days before. So jaundice, constipation, diarrhea, dysphagia, and abdominal pain. These 5-6 cases related to the GIT are coming. They are not specific now. The endocrine or rheumatology will be a long clinical consultation. No, now the pattern has been changed. You can expect anything from any system. So be careful and prepare in a schematic way. Use your schemes. Schemes are very important in a short clinical consultation, long clinical consultation, and your communication. Otherwise, you will be lost in exam and you will not come up with your skills. Work on skills every day in every clinical consultation. My humble advice, all of you, because you are dealing with the skills. PACES. PACES stands for Practical Assessment Clinical Examination Skills. So they are assessing your skills. Work on skills, dear doctors. And thank you so much again. Good night from my side now. Assalamu alaikum.